President Kenyatta, I would like to express my gratitude and my admiration for your leadership and vision in support of WHO and for sponsoring this hub, which will help build stronger and more resilient Africa. And I would also like to use this opportunity to thank the Cabinet Secretary, Mutahi Kagwe, and the Director General, Patrick Amott, and the whole of your team for all their support to realize this vision. I also want to commend our WHO Regional Director for Africa, my sister, Dr. Shidi Moeti, and her team for their foresight and commitment in taking the hub and these vital centers of excellence forward. The African region experiences over 100 health emergencies per year, more than any other region in the world, including outbreaks of cholera, yellow fever, meningitis, measles, Ebola, as well as humanitarian disasters such as the current hunger crisis in the Horn of Africa and the Sahel region. The frequency of these events is expected to increase, sadly. Public health emergencies in the region often prove overwhelming for already weakened health systems and lead to interruptions in the delivery of essential health services and disrupt societies and economies. But it does not have to be this way. Many of these are preventable or controllable with proven public health interventions. We have significant gaps in preparedness that we must address, particularly in terms of the training and building up of an emergency workforce. A WHO analysis found that less than 10% of countries in the African region have the workforce required to prepare, detect, and respond to public health risks. That's why WHO and the government of Kenya have come together to build the Regional Emergency Hub and the Center of Excellence on Health Workforce Training, which we believe can make a difference in the continent. The government of Kenya has generously committed 12.14 hectares of land and $5 million towards construction. The government of Kenya is also generously providing WHO with office space, which can accommodate 120 staff for a 3-year period while the hub is being built. So the work has already begun. We cannot wait until the construction is completed. And that's why the 3-year office space that can help us to start supporting countries in our continent. The office is nearby at the Kenyatta University Research and Referral Hospital. The new hub will bolster resilience and health security in Kenya, in the region, and across the continent. From the hub, we will be able to coordinate emergency response for the Eastern Africa region and organize the delivery of life-saving medical supplies to where they are needed the most in the whole continent. The hub will also be used to stockpile medical supplies and equipment, which will improve effectiveness and allow resources to be deployed to the field more quickly. While the physical building for the new hub is still being constructed, our teams, as I said earlier, are already at work. We're working in support of medical relief around the Greater Horn of Africa hunger crisis, providing supplies and coordinating health assistance efforts for more than 80 million people in 7 countries. WHO has scaled up operations to support countries in the Horn of Africa facing compound challenges: acute food insecurity, conflict, the worst drought in 40 years, devastating flooding, the impact of climate change, and rising international food and fuel prices, all in the midst of COVID-19 pandemic. Beyond the eastern region, the Nairobi Emergency Hub will serve all 54 African countries, African nations across the continent, working in collaboration with both the WHO, African, and East Mediterranean regional offices. Currently, it takes an average of 20 days to deliver supplies to communities across Africa during emergencies. Prepositioning supplies at the emergency hub is part of WHO's effort to significantly cut down delivery time to 72 hours. The hub can also be used by other UN agencies to provide training in areas related to emergency and humanitarian crisis management, including conflict management, food security, logistics, and recovery. Finally, the emergency hub will be fundamental to WHO AFRO's flagship program to strengthen health security, being rolled out with the African Centers for Disease Control, Africa CDC, and other partners. The flagship program aims to better protect Africans from health emergencies by the end of 2025. The hub will improve the capacity of African countries to prepare, detect, and respond to health emergencies, improve logistics capacity, and strengthen health security both regionally and globally. WHO will contribute its share of funds for the implementation and running costs of this regional flagship initiative. The Center of Excellence will enhance Africa's resilience to emergencies by building workforce capacity. The Center of Excellence for the Health Workforce, in collaboration with WHO Academy, will include an emergency simulation village and train frontline responders on topics such as infectious diseases and emergency camp management. I'm glad to see the Kenyan government and other countries in the region taking concrete steps like the hub. This will help to implement the 10 proposals to build a safer world outlined in the Global Architecture for Health Emergency Preparedness, Response and Resilience that I presented during the last World Health Assembly. We were honored that Your Excellency, President Kenyatta, attended the World Health Assembly. Thank you so much. I'm deeply grateful to you, President Kenyatta, and the government of Kenya for their leadership, generosity, and vision in supporting the emergency hub for the people of Kenya and for our Africa.